Welcome to Beyond the Leash, a k-nutos podcast where your pet means the world. Every week, we dive into real stories, tips, and insights to make life with your furry best friend even better. Thanks for joining us. Let's get started.
Welcome to the deep dive. So if you're a dog owner, and I know many of you are, you've probably had that thought. Is my dog actually drinking enough water?
It definitely crosses your mind, yeah.
Right. So today, we're really diving into canine hydration. We're using a helpful pet owner's guide as our base here.
Good source.
Yeah, and the mission is simple. Give you the essential know-how to keep your dog healthy and, well, hydrated.
It's so fundamental. I mean, water is the single most abundant molecule in their body. It's absolutely crucial for, like, almost every function.
Okay, crucial is the word. Let's unpack that a bit.
Yeah.
Why is water such a multitasker for dogs?
Well, think about digestion, for starters. Water helps break down food, sure, but it also transports all those nutrients everywhere they need to go.
Okay. Like a delivery system.
Exactly. And then there are the joints. It's lubrication, basically, keeping everything moving smoothly so they can run and play without discomfort.
Makes sense.
And getting rid of waste products. Water's key for flushing the system. Plus, a huge one, regulating body temperature.
Especially the panting. Right.
Absolutely. That's their main cooling mechanism. So after a good runaround, you need fresh water right there to help them cool down efficiently. It's interesting, too. An average adult dog, maybe 60% water.
60%? Wow.
No, but it varies. Puppies are even higher, like 70, maybe 80% sometimes. Older dogs, or dogs carrying a bit of extra weight, might be lower, closer to 50 or 55%.
That's really good context, knowing how age and condition play a role. So is there a general ballpark figure for how much water they should drink?
There's a guideline, yeah. It's usually around 40 to 60 milliliters per kilogram of body weight. Or if you think in pounds, about half an ounce to 1 ounce per pound, roughly.
Yeah, half to 1 ounce per pound.
But keep in mind, for the really tiny breeds, the giant ones, it's not always a perfect pound-for-pound thing. Their metabolism scales a bit differently, you know.
Almostric scaling, right?
Precisely. And remember, they're losing water all the time. Obvious ways like urination, defecation.
It's the sensible losses.
Right. But also insensible losses, like through panting, which we mentioned, and even through their paw pads.
I always forget about the paw pads. So, okay, if they're constantly losing water, what happens when things get out of balance? When they lose more than they take in? Dehydration.
Exactly. That's dehydration. It's when the body's fluid output exceeds its input, and that really disrupts the balance of water and crucial electrolytes.
And that causes problems how?
It can have pretty widespread effects. Blood volume can drop, which makes it harder for the body to deliver oxygen and nutrients where they need to go. It can also mess with nerve and muscle function.
Including the heart.
Including the heart, absolutely. And we usually talk about it on a spectrum, mild, moderate, severe.
Yeah.
It's also useful to differentiate between dehydration, which is more about water loss from tissues and cells generally,
okay,
and something called hypovolemia, which is specifically a drop in the volume of fluid within the blood vessels. That's a more immediate crisis for organ function.
That sounds serious.
It is. And what's really concerning, and why we're talking about this, is that you often don't see the really obvious clinical signs until the dog has lost at least, maybe, 5% of its body water.
5%? Wow. So the signs are delayed.
They can be, yeah. Which means you really want to be proactive and catch things early before it gets to that point.
Okay, definitely. So we get the why it's important and the dangers. Let's get practical. How can we, check this at home? What are the key things you should look for?
Yeah, there are a few simple checks you can do. One is the skin turgor test. Some people call it the skin tent test.
Right, I've heard of that. Between the shoulder blades.
That's the spot. You gently pinch a fold of skin there, lift it up slightly, and then let go. In a well-hydrated dog, it should snap right back instantly.
And if it doesn't?
If there's a delay, if it kind of slowly sinks back down, that can suggest dehydration. A longer delay usually means more severe dehydration. But a word of caution, it's not always super reliable. In very young puppies or quite old dogs, their skin elasticity is just different. Same goes for certain breeds with naturally loose skin, or even dogs that are very thin.
Good point. So maybe practice it when you know your dog is hydrated.
Exactly. Get a feel for their normal baseline. That's the best way to use it.
Okay, got it. What else? People always mention checking the gums.
Yes, the gums are really informative. Two main things: capillary refill time, or CRT, and moisture.
CRT, okay. How do you do that?
You gently press your finger onto the pink part of their gum until it blanches turns white or pale, then lift your finger off and count how long it takes for the normal pink color to return.
And what's normal?
Should be quick. Ideally 1 to 2 seconds. If it takes longer than 2 seconds, that suggests their circulation might be a bit sluggish, which can happen with dehydration.
Okay, 1 to 2 seconds. And moisture.
They should feel moist, maybe a little slippery.
Yeah.
If you touch their gums and your finger feels kind of sticky or the gums look obviously dry, that's a definite sign of dehydration.
Tacky gums. Got it. And gum color itself.
Hugely important.
Right.
Normal is a nice, healthy pink, but watch out for other colors. Pale or white gums. That can indicate shock or anemia, a real emergency.
Okay, emergency.
Blue or purplish. That suggests a lack of oxygen, another emergency.
Yep.
Bright, almost cherry red gums could mean overheating or sometimes carbon monoxide poisoning. Yellow points towards liver issues or jaundice. Muddy brown is also a very serious sign.
Wow, okay, lots of warning signs there. What if your dog has dark or pigmented gums naturally?
Good question. In that case, you can gently pull down their lower eyelid and look at the color of the tissue lining the inside. It should be pink, just like the gums.
Ah, the eyelid lining. Smart tip. So besides these physical checks, are there behavioral things you might just notice?
Oh, absolutely. Sometimes the first signs are more subtle. Maybe your dog is just a bit more tired than usual, more lethargic, or perhaps they're panting more, even when they haven't exercised much or aren't hot.
Okay, lethargy, panting.
A persistently dry-looking nose, those tacky gums we talked about, maybe they seem extra thirsty all of a sudden, or conversely, you notice they haven't peed as much as usual. Those are often the earlier, milder signs.
So things you might dismiss if you're not paying close attention.
Exactly. Then, as it gets more moderate, you might see that loss of skin elasticity becoming more obvious. Maybe they lose their appetite, the gums get very dry, and their eyes might start to look a bit sunken.
Sunken eyes, okay. That sounds more serious.
It is. And in severe cases, the eyes will look obviously sunken and dry. The dog might be extremely weak, maybe even collapse. They could seem confused.
Oh, dear.
Yeah. Persistent vomiting or diarrhea can also cause or worsen dehydration rapidly. You might notice their heart beating faster, and those abnormal gum colors we discussed become more likely. The key takeaway, really, is that by the time you're seeing those really obvious dramatic signs like sunken eyes or collapse, significant dehydration has already occurred.
Yep.
You want to act before it gets that bad.
Right. Prevention and early detection are key.
Absolutely. And it's about putting it all together, isn't it? Like a slightly slow skin tint test on its own after a hard play session on a hot day might just mean they need a good drink. But that same slow skin test combined with tacky, pale gums, and lethargy, that's a different story.
Yeah, context matters.
Totally. Thinking about your dog, their breed, how old they are, how active they tend to be, that really helps you understand their individual needs and what might be normal or slightly off for them.
That's a really crucial point. It's not one size fits all.
Not at all.
So, the final thought for everyone listening. Take a moment to consider your own dog. How might their specific breed, their age, their typical activity level influence how much water they need?
Yeah, what little tweaks could you make today? Maybe adding an extra water bowl or taking water on walks more consistently.
And think about those subtle signs. What might your dog do specifically if they're just starting to get a little bit dehydrated? Knowing their little quirks could make all the difference.
Definitely something worth mulling over. Being observant is half the battle.
Thanks for listening to Beyond the Leash, a K-nutos podcast. To discover more tips, stories, and everything your pet deserves, visit us at www.k-nutos.com. And don't forget to follow us on YouTube, Instagram, TikTok, and Facebook. Just search for K-nutos. Until next time, because your pet means the world.